Our guest today is Kayla Young. She is our representative of the 56th district, of which I am a member of it, and she does a lot of extra work in a lot of things, but she has a very big interest in child care. And she is a member of the West Virginia Child Care Committee. Mm-hmm. Welcome.
Welcome. Thanks for having me. I'm excited to be here.
Now the question is, what is the West Virginia Child Care Committee?
Yeah, so we have a Seniors, Children's, and Family Committee in the legislature, and we have a child care task force because we realized during the pandemic that there was a child care crisis going on in West Virginia, and there were a lot of folks who need child care in our state.
So the COVID epidemic didn't cause the problem, but it accentuated and brought it to our attention.
Yeah, that's right, because a lot of people realize they can't go to work if they don't have child care somewhere safe for their kids to be.
Well, that's now a big problem right now.
That's right.
So, do we have a child care crisis in West Virginia and the United States?
We do. So it's not just West Virginia, it's absolutely every state. But right now in West Virginia, we have about 25,000 children who don't have access to child care, and that's with both of their parents working. So we have a lot of kids that don't have accessible child care because the spots just don't exist. We need to create more child care, but then also make it affordable.
Two things now. When I was practicing for all those years, I often had the children being brought in by their grandparents. And a lot of these 26,000 kids are probably being raised by either the foster parents or their grandparents.
That's right. We've got over 6,000 foster children in West Virginia, and they're being raised by a variety of people. And thankfully, we have some foster families. We always need more foster families. But we also have a lot of kids in West Virginia who are being raised in kinship by someone who's not their parent, like a grandparent or an uncle or aunt. But yeah, we have a lot of kids in crisis in West Virginia. We're trying to do all we can do in the legislature to help them out.
How does one take care, how do you find people to take care of these kids that don't have somebody in the family? I guess do they still call them foster children like we used to when I was growing up?
Yeah, so it's called kinship care. If you would go live with a grandparent, that would be kinship care because they're in your family.
Yes.
It's also kinship care if you go live with your teacher at school because you already know that person and have a relationship with them. But it's foster parents if you have someone who isn't in your family at all caring for your children. And we need foster parents everywhere, and they sign up through foster care agencies.
I do know of a couple of cases where the people who were foster care parents actually adopted the kids, and I think one or two of those were teachers.
Usually, yeah, there's a lot of that, and thank goodness, because it's always a good thing when kids can get adopted.
Fantastic. Now, okay, some of these teachers, they're working. A lot of the people like grandparents aren't working. They have barely enough income to take care of themselves. Do we compensate them for taking care of the children?
They do get compensated. It's not very much. It covers some of the basic necessities for the kids, but there's a lot of need.
All right, I'm a grandparent and I have 3 grandchildren I'm taking care of.
Yeah, that's
Do they
difficult.
pay me for each one?
Yes.
Okay.
But it's not very much. Nobody's in it for the money.
It's like they used to call it, if I remember right, milk money. So this is a big problem. So we do have a crisis.
Yeah, we have a child care crisis. We have a foster care crisis. We've got all kinds of crises going on that are affecting children in West Virginia.
Tell us about all these crises.
So with child care specifically, it's a problem because parents can't afford child care. It costs more than college out of pocket typically. On average, it's about $250 a week. So some people, it's easier for them to stay home than it is to, then they don't miss the time with their children. So it's expensive. But then the child care centers are operating on very thin margins. They have to pay their staff a lot of money, and they're doing very important jobs of raising our kids. And then employers need people to be able to come to work. And so businesses want to help out, but it's really expensive for them to help out too. So we're trying to solve all 3 arms of that at the same time.
Well, during COVID, a lot of people who had jobs on computers might be able to stay home and take care of their kids, but I'm sure that still affected how the kids were taken care of.
Yeah.
You have young kids, let's say under 4, and you're working, they need attention almost every minute of the day.
And instruction too.
And,
so
yes.
yeah, they need to learn. So yeah, my kids are 9 and 10, and if they're at home, I can't get a lot of work done.
Now, when you're in the House, West Virginia House, you are the minority leader pro tempore.
I am.
Does that have anything to do with your committee work with children?
It doesn't have a ton to do with it. So what that means is if my minority leader is gone for the day or something, then I step up for him. But it does allow me to advocate for child care and all the work that we're trying to get done in the State House. So a little bit.
Do you have your own hammer?
No. A gavel? No,
Yeah.
no, I don't get to run any of the committees. I wish I did.
Yeah, I can just hear you.
Maybe you need one.
So which groups are most impacted and need more solutions to help them raise these kids?
Parents, mostly. It's very, very expensive, and they need to be able to work, but they also want to spend time with their kids. And also the kids themselves are the most impacted. We want to make sure that they're in the best learning environment possible. The first 1,000 days of a child's life are without a doubt the most important. That's the first 5 years. And if we can make sure that they're learning and that they're in safe environments, they're being fed several meals a day, then we're setting them up for success. These are our future generations we're talking about.
Well, I haven't been a baby for many, many years, but my oldest sister, she's 95 now, she helped raise the 3 or the 4 that came after her.
Yeah.
And in those days, my day, family took care of family, and the kids often took care of the other kids until their parents came home from work.
Yes, they did.
It's a different world right now, and there are many different problems. Schooling, getting them to school. What is financing the biggest problem?
One of them, yeah. But also we want to make sure that the teachers, because they're teachers that are helping these kids learn in early childhood education, they don't get paid very much, but parents can't afford to pay any more. So they operate on really thin margins, and so they can't charge parents anymore. They can't make it the true price of child care, the actual cost. They can just charge what people can afford.
So you're talking about child care facilities, not necessarily school.
Yeah, that's right. But also in schools, I mean, we don't spend as much money per pupil on students as a lot of other states do. So we want to make sure we're setting kids up for success.
Do the teachers know generally who are foster care kids or the kids that have problems at home?
Not necessarily, no. They're not necessarily made aware of who knows what's going on and what, and circumstances can also change throughout the year too. So no, they don't necessarily know. We expect a lot of teachers.
Should they know?
I think they should know, absolutely. So then they can handle those kids with some extra care because they've got a little more trauma and a little more, different experiences.
Yeah, I would think that these kids maybe that are having these problems aren't that interested in studies and direction, tell me what to do and what not to do. They get tired of this. But it's very important. These are very formative years in a child.
Yeah, but imagine not being able to focus with all these different adverse childhood experiences you have going on. We had a bill in the legislature, we haven't gotten it passed yet, but a few other states have, called an ACEs score. And it's a test that you can test children for, and it will tell you, it stands for Advanced Childhood Experience, ACE. And you do the test and you figure out kind of what the child's upbringing was like before they came to school, and then they can work on how to handle them moving forward to make sure they're getting the best learning experience possible.
Well, even our kids who have parents who take care of them and feed them and have enough, still, we have many kids leaving high school who can't read properly, they can't write, and math is awful.
Yeah.
Now, the Chinese take their select students. and like maybe in the 5th grade, they start teaching them calculus.
Yep.
I didn't get calculus until I was in college,
Yeah.
and then I didn't take it. So this is a big deal. Is the federal government still trying to pass, or President Trump is trying to pass something to give child care advantages to these situations?
So during the pandemic, there were a whole lot of things that helped the child care. Those have gone away pretty much extensively, but some of the rules are still in place. So we're going to be paying child care centers differently now. There's a bit more funding available, but the federal government is hopefully still trying to get some stuff done. They've got some stuff done through rules this year, but really it's kind of up to the states right now. And lots of states around us, Kentucky's one, have put hundreds of millions of dollars into child care recently.
Well, I'm sure Kentucky, being in same situation as West Virginia in past years, that's a lot of money for them.
Absolutely.
Yes.
It's expensive. Yeah.
Yes. Well, there was something about President Trump wanted to make child care expenses deductible or not be taxable. They're working on some things. Do you know anything about what they're trying to do?
So they tried to do it during Build Back Better. President Biden tried to do it in 2021, and that bill did not pass. I don't know what's coming, though. They're trying to do child care. We had child care tax credits during the pandemic that were really, really helpful. It lifted 50% of kids out of poverty. And so West Virginia could do a child care tax credit that is refundable. That would be really helpful. We tried to do that during this recent special session and weren't able to get it done. But there's a lot of things we can do tax-wise. We can also do tax breaks and tax cuts for businesses that pay for child care for their workers. That's a big one that would be really helpful.
Oh, so are there any businesses that let the parents, particularly a new parent, work at home or pay them while they're off? I think in Canada you can get a year's leave.
Paid leave, yeah. So we're one of the only countries in the world that doesn't have any type of paid leave at all. Some states do have it, and even in this recent election, there were some states that had ballot measures to do paid leave. But yeah, we don't have anything in West Virginia. We've been trying to do that for a while, whether it be for state workers or for all workers, but then it requires everybody to pitch in. There's a couple different ways you could do it. A payroll tax credit, just a big pot of money that everybody pays into. There's a lot of different methods, but that's something that they've been trying to pass at the federal government for a long time and at the state government.
Are you trying to pass that?
Yeah, I've been trying to get paid leave done for a long time. FMLA that came in the 90s was supposed to be the precursor to paid leave, and we just stopped and never kept going.
Sweetheart, you know business. To pay somebody for a year to take care of their baby, that's an enormous amount.
Absolutely.
Now, I don't know in Canada, but I suspect that pay may not be taxable. I don't know how they do that.
Yeah, I'm not sure, but we're not trying to do anything like a year. I mean, we've talked about 8 weeks, 6 weeks, 8 weeks. Any amount of time that new parents can spend bonding with their children is helpful, but a year's a bit much, yeah.
We're having trouble getting people to go back to work.
Yep.
After COVID, or so many just are in the job field, but they're not trying to work. Mm-hmm. They go for appointments so that they can say they're trying to get a job, and then they collect this
unemployment. Unemployment.
Unemployment. Yeah, we see that in some of our family businesses. It's amazing. From what you're telling me, these are not really new crises.
No.
They recur, or they're all the time, but certain things like COVID make it worse.
COVID shone a light on it so then people could see how big of a deal it was, because when the schools closed down, people realized they really relied on the schools for them to be able to work, public education. So then when schools weren't there anymore, the parents still had to go to work, but where did the kids go? They didn't know what to do. So then people were like, oh my gosh, childcare really is, kind of the workforce behind the workforce. Parents can't go to work if they don't have somewhere safe for their kids. So it really let people know what was going on. But yeah, it's not a new crisis. It's not unique to West Virginia. There's nothing we did to get us here. But we've got to figure it out so folks can get to work.
Are there certain groups that are more impacted and needs different solutions than the average kid in problem?
So some people who work third shift, for instance, if you're a doctor and you work in the ER overnight, there aren't child care centers that are open that late, you know? Or if you work in manufacturing second shift, typically they're open from 6 in the morning to 6 in the evening. So unless you have a 9 to 5, you have a difficult time finding childcare. You might have to use a friend or a neighbor or someone who just kind of does it under the table. It can be hard.
I missed that point because, God bless her, my wife raised 4 kids all by herself. I was never there.
Yeah.
So yeah, that's a big one a lot of people don't realize, because a lot of people do work later in the day.
Yes, they do.
And in the evening and at night. Are there child care facilities open for those hours?
There aren't, no, not very many. Very few at all, because how do they get staff to be there overnight? It's hard. So no, there's not a lot of those. Typically those people, they figure it out some other way, or one member of the family stays home.
Do we anticipate any new crises for any reason coming up?
I hope not. I really hope not.
Well, if you may have heard that there's several measles cases.
That is one.
And in my day, if somebody on the block had measles, we all went over and had a measles party.
Yeah.
Or we got vaccinated. People are ignoring routine vaccinations now, and we're going to get into trouble, particularly with the influx of the illegal aliens who are carrying all kinds of things in. So if we have a child in somebody's care, who checks on them? And the reason I bring that up, if you remember the case of the young lady, 13 or 14, who starved herself to death, and her mother and grandparents were, I think, taken to court over this. She died. Kennedy was her name, but it was spelled totally different.
Yeah.
Who watches out for these kids? Who makes sure they're taken care of? We recently heard about a couple of kids or more that were being locked in a barn every day without proper facilities.
Yep.
In the past, I can remember cases where several kids were locked in a room every night. They were put in cages in the room. How do you find these cases?
It's
Who is
very
watching
scary.
out for these kids?
Their parents are supposed to be watching out for them, and that's what's happened, is that their parents are not watching out for them and no one checks on them. So at least in the case of Kennedy Miller, which was the Boone County case earlier this year in 2024, she was pulled out of school to be homeschooled, and so then nobody checks on her anymore. There's supposed to be a few checks. There's 4 checks throughout your school experience if you're homeschooled. And so, yeah, no one checked on Kennedy, and who knows how long that had been going on. It was really, really unfortunate. So, yeah, and then they said that some people called the Department of Health and Human Services to check on her, but that I still don't really understand exactly what happened. There's some conflicting stories there, but yeah, her grandparents and I think parents are in jail right now. Yeah.
Yes. Well, they said that she wanted to die and she wouldn't eat, if I remember right. I heard that somewhere.
Yeah, I don't know about that.
So, okay, let's talk about a foster child.
Yeah.
Is there somebody that checks on them and their care?
They're supposed to be, yeah. They have CPS workers, Child Protective Services workers that check on them, and I'm not sure how frequently they're supposed to check on them, but yeah, with foster care kids, they are supposed to have people checking on them. If it's your own parents, then, you know, there's parental choice, and I don't know that that parental choice should allow you to abuse your kids, which is what happened to all these kids.
Well, I can remember when I was growing up, I'm still growing, but if you didn't go to school, they had officers that went around and checked why you weren't in school. Do they still do that?
They do have that. Each school has one of those.
Truant
but
officer?
yes, they have a truant officer, and we've changed the truancy laws recently to get kids to school. And at least in Kanawha County, they're getting to school. But we have a truancy officer, but they're responsible for hundreds of kids. It's hard to keep up with them all. It's impossible. These school administrators have so many things that they have to do.
Well, what can the average West Virginia citizen do to help in these cases?
I think it's know the kids in your community and get involved in your community. These situations are so sad, and I don't know if people. There was one in South Hills recently that happened where there was a child found in handcuffs, and the people in the neighborhood didn't even know there were kids in the home. So I think the average citizen can call their legislators if they care about these things, and we're very easy to get a hold of. But also they can just be involved in their communities, and I think that's really important to do.
So if any of our public saw situations where the kids, like you say, they didn't even know these people had children.
Yeah.
If there's something suspicious, A, should they report it? And B, whom do they report it to?
Yes, they should. There's a child abuse and neglect hotline that they can call through the Department of Human Services, and they should always call it. And then there's a lot of people that are mandatory reporters: doctors, law enforcement, teachers, coaches. They have to report anything. Mandated to report anything. But everyone else should. If there is something suspicious, they should report it, because we have to take care of our kids.
I would think that this is something that maybe many mailmen, paper deliveries, UPS people, these people who deliver to homes, particularly if it's like a mailman that's on a repetitive
Sure.
basis, might notice some strange things.
Yeah, maybe.
And in their position, I don't know if they have to report who. If somebody comes to my door and says, you're not taking care of your child or your dog, do they tell me who reported me?
No.
It's private.
That's right.
Do you see much of that?
People calling?
Yes.
Oh yeah, thousands a month. There's a lot of calls.
And whom do they call?
The Department of Human Services, and then that's CPS, the Child Protective Services. They call them, and then those people are tasked with investigating them. But we always need a lot more of those workers. That's a really, really tough job. It doesn't pay super well, but it's incredibly important work. It's very difficult.
I would assume that a lot of time the people don't know where to call. They'll call the local police department.
Yeah, and they'll point them in the right direction.
Is that a big does that happen often?
I think it does happen very often, yeah. We have a lot of abuse and neglect of children in West Virginia, and so, yeah, it does unfortunately happen often.
The job situation in West Virginia has actually maybe improved a little bit, but there's still a lot of jobs available, and people aren't taking advantage of them. I don't know that having kids at home and not being able to pay for child care keeps some people from getting a job.
I think it does keep some people from
Because
getting
of the
a job
cost.
because of the cost. I mean, one child, it's about $15,000 a year.
That's more than some of them make a year.
That's right, yeah. But we do have more jobs than people. And so if you have more than one child, just think, that's $30,000. Why would you waste that time that you could be spending with your kids and not make any more money, you know? So, yeah, I do think it keeps some people out of the job market. But we do, yeah, the jobs are improving in West Virginia. We have currently more jobs than people, but our workforce participation rate is still very low in the state. So we need to do whatever we need to do to get folks to get to work.
All right, with the current situation where they've let millions of people come into the system or into the estates, I can anticipate, or should we anticipate, that there's going to be a lot more kids out there that are not taken care of properly.
I don't think so. Not in West Virginia. Yeah.
Well, I'm talking about the United States now.
Potentially, if there's, a lot of young children coming in. But they can typically access services that are available. There are services. There's help with at least in West Virginia. There's help with child care. There's services for getting kids. You know, they deserve educations, and we got to make sure we're taking care of kids, regardless.
Now, CAMC actually has a children's advocacy center. It opened in 2005. I don't know to what extent they get involved, or if it's more involved with their patients or their staff's problems. I don't know how they handle that, but I don't know they have it. Are there any other organizations that help in child care in our state?
There's all kinds, yeah. So there are associations for all the child care providers, West Virginia Association for Young Children, and those help the providers kind of with trainings. They help with all sorts of things. We have our resource and referral networks, and those are who actually administer the child care program in West Virginia. Then we have groups like Team West Virginia, Prevent Child Abuse West Virginia. We have a group called Moms Rising. There are all kinds of groups out there to help kids in West Virginia. Then all the foster care networks as well.
Some of those are state organizations and
Yes.
some are not.
That's right. Some are nonprofits, some are state. There's the whole gamut.
Are the churches involved in this very much?
They are, yeah. There's a lot of churches that have child care centers in them. They're really a great space to have a child care center because they usually have a big kitchen. You got to have a lot of things for a child care center, a lot of specific things, playgrounds, inside space, outside space. So churches make really great child care facilities.
Is DART involved in any of this? Are you familiar with DART?
No.
That's the organization that gets all these people who are willing to help and congregations and help others and gets them together. I've just talked to some of their people occasionally. Let's look at the future now. What are the main big problems that we're going to run into here and in the country with child care?
Making sure that people can access it. We need more child care. We need to make sure the kids are learning properly so then they're ready, set up for the future. We need to make it affordable. We need to help businesses be able to get workers. There's a lot of options, and thankfully there's a lot of solutions out there too. Lots of states. I work with a lot of folks in a lot of other states, and recently got to go to the White House and speak about child care policy. And so there's a lot of solution sharing, and I think we know the answers. We just kind of need to do it.
Well, I heard you speak at the Wonder Woman's thing, and it was excellent. You're obviously a people person and have all this energy. What is the one big thing that you're going to try and do in the legislature this year to help in this situation?
One of the biggest things that we can do is a tax cut for businesses to make them so where they can pay for as a benefit to their employees, pay for their workers' child care and get a tax credit for it. That's one of the one things we can do really easily to open up more child care spaces and help everyone involved.
Well, I want to thank you for being on our show. I know your time is very limited, and particularly for what you do. This is a major thing for West Virginia. This is Dr. Richard C. Rashid, hoping you'll see a bright day.